Good morning, good afternoon, good evening, everyone, depending on where you are connecting us from. Welcome to the global launch of the FIP Digital Health in Pharmacy Education Report, which represents an important step towards developing a digitally enabled pharmaceutical workforce. Thank you for joining us live today, and thank you to those who will be watching the recording afterwards. I would like to check in with our participants today from all over the world. Please let us know by typing into the chat box what does digital health in pharmacy means to you in one word. The next slide. I would like to warmly welcome our speakers and panelists. At this global launch, we are together with the co-authors of the FIP Digital Health in Pharmacy Education Report, as well as FIP leadership, who will be sharing their views on digital health from the perspectives of pharmacy practice, pharmaceutical sciences, and education. This global launch is moderated by Professor Okya Mantel, who is the chair of the FIP Digital Health in Pharmacy Education Report, whom I'll hand over to shortly. And this digital event is facilitated by myself, Shirley Melianti, and Bidata Katri. I would like to thank to both of them for their support in ensuring this event runs smoothly. My name is Nilhan Uzman. I am a pharmacist trained in Turkey. I'm the lead for education policy and implementation at FIP. I am leading FIP's Digital Health in Pharmacy Education program, and I'm one of the co-authors and co-editors of the FIP Digital Health in Pharmacy Education report. Next slide, please. Before we start, I would like to share a couple of announcements with you. So this webinar is being recorded, and both report and the recording will be available at our website, www.fip.org. You may share your questions to our speakers, to our panelists by typing them into the Q&A box. During this event, we'll have several Q&A sessions that we will collect your questions. And if your questions are not answered at the Q&A session, our speakers will respond to you in the Q&A box. So basically follow the Q&A box and type your questions there. We would like you to join the conversation on social media. So if you have any insights, any questions, anything you would like to share about today's event and our report, please use digital health, pharmacy education, and transforming pharmacy hashtags. You will also experience a digital health education simulation at today's event, and we hope to receive your feedback at webinars@fip.org for us to improve our events further. Next slide, please. So about today's event. Today, we are celebrating the global launch of the FIP Digital Health in Pharmacy Education Report. At today's launch, we'll be presenting the key findings from the FIP Digital Health in Pharmacy Education Survey and key messages from the report. You will explore digital health education and training initiatives from pharmacy schools, and you will also identify areas of development for the long-term vision of digital health in pharmaceutical practice, science, and education. Next slide, please. So that's all from me. Now I'm pleased to hand over to our chair and moderator for today's global launch, Professor Okya Mantel from the Netherlands. She's the director of Utrecht University School of Pharmacy. She's the chair of FIP Digital Health in Pharmacy Education Report. She is also a member of FIP's Technology Forum, and she is also the FIP Academic Pharmacy Section Executive Committee. Over to you, Okya.
Thank you, Nilhan, for this introduction. Also, on my behalf, very welcome to all colleagues around the globe to this event. What started some months ago as, at least in my mind, a small project has now turned into a rather big report with a lot of interesting chapters, a lot of interesting findings. And I'm really happy that we can launch this report today with also such a large audience. Before I go into what we aimed with this report, I would also like to invite all of you to participate in an interactive way in this session by putting all of your questions in the Q&A. So we will have ample time, or at least ensure that there is time to go over all of your questions. So I think what Nilhan already mentioned that this is the first of its kind report, and it presents the finding on a survey that we developed and that we sent out to academics, practitioners, and students. And we were overwhelmed by the number of responses. Over 1,000 colleagues and students responded from a wide variety of countries. So the survey asked about, and the report therefore describes, the readiness, the adaptability, and the responsiveness of pharmacy education, and also the knowledge and skills needs of pharmaceutical workforce on digital health. And I would like to stress that it is important to acknowledge that it is not only knowledge that we need, but also specific skills that we need to incorporate digital health technologies in pharmaceutical care. So it also describes some education initiatives that we have seen in pharmacy schools as examples that others could draw upon, and not only from pharmacy schools, but as far as I know, also, for example, from continuous education. So we hope that this report will serve as an evidence base to integrate digital health and digital health education and equip the current but also future pharmaceutical workforce with the necessary digital health knowledge and skills. Next slide, please. Of course, this would not have been possible without contributions from many among you also in the audience today that contributed to either the survey of the report. So I would like to express my sincere thanks to the core and analysis team, to the extended team and contributors to several chapters. I also want to especially acknowledge the FIP Technology Forum members and people from the YPG and also IPSF. The survey was done in many languages, so we are also grateful to the translators. And finally, of course, also to the reviewers of the report listed here, many of them who have served FIP and are in FIP leadership for many years. So again, thanks to all of you. And maybe most importantly in the next, well, not slide, but the pop-up is also to, well, it says thousands, but at least over 1,000 of respondents to the survey from all over the world. So a heartfelt thank you to all of you. Next slide, please. It's now my pleasure to hand the word over to Jacqueline Surug, FIP Technology Forum Chair and FIP Vice President, to also add a few opening remarks.
Thank you, Auke. Dear colleague, what could I say to introduce this marvelous report? Today, digitization is everywhere. It is in our daily practice, in our professional life, in the way we practice pharmacy. It is transforming the healthcare landscape, and this compels us to fully rethink healthcare for the digital age. Every day brings technological advances. Every day brings new innovative solutions. But the problem is that these new technologies, advances and solutions are becoming more and more complex and difficult for healthcare professionals to embrace. And even worse, there is a high risk that the rate of these technology advances and innovations and their complexity may outpace the ability of healthcare providers to integrate them and healthcare professionals' ability to implement and adopt them. This is where digital competencies are required. And this is the purpose of this FIP report. FIP report, which is in line with the FIP development goal number 20 on workforce on digital health. And it's also a major topic of discussions in the technology forum at FIP. Because education, digital education, is not only on knowledge and skills, but it is on behavior, on the behavioral intention, on the technology acceptance, the readiness, the open-mindedness, the adaptability. These are the qualities that will be required for students to feel comfortable, open, secure, and confident to guide pharmacy into its digital future. This is what we are going to see now in details. And I hand it over back to you, Aukje.
Thank you, Jacqueline. And I think, as you already kind of mentioned, is that digital health is definitely a topic that unites and cuts across many different sections, definitely the academic pharmacy section, and of course the technology forum, but I think it's across the profession, science. And so if there's one topic that really unites FIP, I think it's digital health. So in the first part of this meeting, we will go into the findings and key messages and launch of the report. Then we will have a rather short intermezzo with a video on digital health education simulation. And in the final part, the second hour of this meeting, we will have a global panel discussion on the way forward and how we can build upon the findings of this report within FIP and beyond. Next slide, please. So moving to the first part, I will briefly for each chapter introduce the speakers to you. The first chapter is a more general chapter on digital health. So first of all, Nilhan, who already introduced herself, will give an introduction and mention global perspectives. And then we have two experts on the topic of digital health, both part of the FIP Technology Forum, our colleague Jaime Acosta Gomez from Spain, who will talk about practice perspectives, and our colleague Claudia Rijken, who will give us a glimpse of the future. So over to you, Nilhan.
Thank you, Aukje. Next slide, please. Yes, thank you. So by tradition, we start with defining what is digital health. So I wanted to thank our colleagues for providing their input already. So we've seen colleagues mentioning better patient outcomes, transformation, catalyst, e-prescribing, future of pharmacy, empowerment, connections, opportunities. So thank you for defining digital health so broadly. And we know that this is a definition that is going to evolve every single day. But if we would like to define it officially, according to WHO, World Health Organization, digital health is the field of knowledge and practice associated with the development and use of digital technologies to improve health. This is a very broad definition, and along this event, our speakers will deep dive into different aspects of digital health. Digital health technologies save lives. They improve health, well-being, increase access to care, lead to effective health systems and healthier populations. With increased complexity of health conditions and aging populations, digital health can be key to many unmet needs in health and related services. That is why digital health is a top priority across major policy and health organizations. So at our report, we scan the global digital health agenda, and the adoption of digital health and standards of digital literacy are key themes of interest at the global level. If we look at the specific organizations, the impact of digital technologies is identified as one of the 5 mega trends by United Nations that are affecting economy, society, and environment. In the UN 75th anniversary report, it is listed as 5 megatrends, as we mentioned, and digital health is linked to the achievement of many UN Sustainable Development Goals, and its positive impacts should be maximized for society's benefits, according to the United Nations. If we look at the World Health Organizations, harnessing new technologies is one of the top priorities of the WHO's urgent health challenges for 2020s. The WHO has developed a global strategy on digital health to improve health for everyone everywhere by accelerating the development and adoption of digital health solutions, developing infrastructure, applications that enable countries to use health data to promote health and well-being, and to achieve, again, the health-related sustainable development goals. If we look at the OECD, the Organization for Economic Cooperation and Development, in its latest report mentioned that digitally enhanced health services can improve access and help move away from reactive towards proactive approaches to preserving health. And the World Economic Forum has emphasized that few industries have the potential to be changed so profoundly by digital technology as healthcare. Building on all of these global policies, FIP Development Goal 20, Digital Health, focuses on enablers of digital transformation within the pharmaceutical workforce and provides mechanisms and processes to facilitate the development of a digitally enabled workforce. We all witnessed how COVID-19 pandemic has been pushing the digital health agenda forward globally. The digital health transformation accelerated by this pandemic will have a lasting global impact on healthcare services, and important lessons will be learned from this digital health transformation. Now I'm going to hand over to Jaime to deep dive into digital health, impact of COVID-19, policy and practice perspectives. Over to you, Jaime.
Thank you, Nilam. Hello, everyone. So happy and honored to be with you today. My name is Jaime Acosta, Jamie, if you wish, and I'm a practicing community pharmacist from Madrid, Spain. And I'm incredibly lucky to be serving now in the FIP Community Pharmacy section, the FIP Technology Forum, and the FIP COVID-19 Global Expert Advisory Group. Recent technological achievements have revolutionized clinical practice, from prevention through diagnosis, monitoring to disease management, and enabled unprecedented engagement in self-care and well-being. Global health has improved dramatically in recent decades. However, the current model for providing healthcare is being slowly torn apart by the opposing forces of an aging population and greater restraints on spending, among others. Maintaining the status quo is not an option. The healthcare system of the future will look vastly different, with a crucial change towards consumer-centric healthcare, allowing citizens to have much more responsibility for managing their own healthcare, with a shift in focus to early prevention. At the beginning, the most noticeable change for a citizen is that now fewer trips to a physician, hospital, or pharmacy, of course, are being required in many jurisdictions now. Through self-care and monitoring of vital signs, an individual's health could be continuously tracked. If needed, a virtual care consultation could be arranged so that citizens could receive human or automatic advice at any time. Should further care be necessary, the treatment plan would be personalized for each individual, maximizing the chances of a successful outcome. Next slide, please. These are the tools described in the report. In the interest of time, I won't get into any of these technologies. They are all available to you and well described in the report, relating them to the specifics of pharmacy practice. Please consider downloading the report for more information. Next slide, please. The COVID pandemic has been a huge challenge, but it has revolutionized pharmacy practice in some positive ways. It is being a powerful stimulus in catalyzing the use of technology too. In the era of digital health technologies, the focus of new and existing pharmacy services has shifted to virtual visits, virtual care, remote patient monitoring, websites, and chatbots. Under its National Health Plan for COVID-19, the Australian government has accelerated the delivery of electronic prescriptions. Also, Australian pharmacists have been able to undertake different remunerated services via telehealth, as meds checks, diabetes meds checks, home medicine reviews, and residential medication management reviews. In Canada, pharmacy distance services have been implemented, and many of them are independently remunerated since COVID-19. Counseling, assessments in order to prescribe, meds check services, witnessing the ingestion of a specific treatments, demonstrating the use of a medical device, provide the prescribing consultation or prescribing services, medication reviews, drug information services, assessments for minor ailments prescribing, smoking cessation services, and extending prescriptions, between others. In England, some patients referred to the community pharmacist consultation service through NHS 111 have been dealt with over the phone, and pharmacists have still been able to claim the normal fee. Pharmacists have also been conducted the new medicine service and medicines use reviews via phone and video. In Scotland, the NHS Near Me video consultation service has been available to all Scottish community pharmacies. A video consultation service is used by pharmacists in Wales to provide advice for common ailments, smoking cessation, emergency contraception, and discharge medicines reviews. Next slide, please. Decisions to adopt new digital health services at different levels of the healthcare system are ideally based on evidence and ethics regarding their performance, considering health system goals. These governance goals, in a broad sense, are unaltered by the process of digital transformation. Many digital health technologies strongly depend on their uptake and appropriate use by healthcare professionals. As an example, the British NHS TOPO review related different technologies with the magnitude and speed of impact in the healthcare workforce. Telemedicine, apps, wearables, the genome, modified reality, and artificial intelligence will have a deep and fast impact in a beautiful profession. This is all from me for the moment. Over now to you, Dr. Reitken. Thank you for your attention.
Yes, thank you, Jaime. Hello, everybody. I'm Claudia. I'm a community pharmacist in the Netherlands, and recently I've started a digital pharmaceutical care startup, and I'm happy to share with you an outlook on the future of what we can expect from digital health in pharmacy. If you look to the analogy and the world around us, we can learn quite a lot from the automobile industry. The left picture, you see that only some 130 years ago, this was the first car, the first automobile. And when you would start a journey, you would not know if you would ever end, because you would not know what would be the pressure in the tires, whether the engine would be maintained and running, whether there was enough fuel. So your journey was not really predictable. And some of you have seen the cars on the left and on the right side, the electronic cars that really have a dashboard that shows everything that you want to know, including the traffic jams, etc. And you really have a dashboard of the status of the car that gives you quite a high predictability whether you will be in time on your next appointment. If you go to the next slide, that is pretty much the same as how I see that digital health is evolving. The human body is a fundament of a dashboard, indeed on the left side, where more and more digital biomarkers are predicting the actual status of the body and how it's going to evolve. And those digital biomarkers are basically biomarkers, parameters derived from technology. And if you're interested on knowing which kind of technology is upcoming and which is considered as a standard of care, on the left side, you see the annual released digital health hype cycle, which you can find just on the web, and which gives a nice overview of, on the left side, technologies that are upcoming, to get even a more sophisticated view on how the well-being of the body is doing. And on the right side, technologies that are quite well matured already and are in some countries even already standard of care. So if you look at these digital biomarkers, of course, the question will be which will be of most relevance in the future for our pharmaceutical profession. And if you go to the next slide, I just have a couple of examples of which I think that in our future jobs, they will well, appear more and more as a standard parameter that we have to take into account. Kaime was already referring to it as well, but for example, wearable data from Fitbits, like the amount of steps that a person can make, or the heartbeat, or other sophisticated wearables like Parkinson watches or epileptic tracking systems. They provide data that say something about the well-being of the patient, but that also say something about the efficacy and sometimes even the safety of how the medication is tolerated. The same is applicable to, for example, health apps. And with health apps and the fact that more and more patients are using them, pharmacists have the opportunity in the future to remotely monitor patients much more hours a day than we are currently doing. Currently, when people leave the pharmacy, you don't know how they're doing. But with these data being shared with pharmacies, we can make more sophisticated decisions, more personalized decisions. Robotic support, for example, virtual humans, virtual assistants, which can 24/7 answer questions to patients about medication, which are then referred to you if the robot cannot answer them. And of course, artificial intelligence, which is helping us to predict the outcomes of treatments and the outcomes of interventions. Next slide, please. With that having said, I would like to conclude that I believe that the future outlook for a pharmacist is not only the logistics, but is most importantly being the driver of pharmaceutical care, in a way that with a dashboard, how the patient is really doing, can make more sophisticated, more personalized decision. And like they sometimes say, technology will not replace pharmacists, but pharmacists who use technologies will be better enabled pharmacists. And one thing to say about that is as well that I think the best way to position it is as a blended care model. So a human care enhanced with technology, the human professional making the ethical decisions and helping the patient in an empathic way, supported by an individualized dashboard to really offer the most personalized care. That's it. I hand over to Aukje again.
Thank you, Claudia. And part of the reason why we had such great response to our survey is because Claudia offered 3 free copies of a book that she wrote on pharmaceutical care in the digital revolution. So what we did is we draw winners from each different section. So from among the students, among the healthcare practitioners, so the pharmacists, and among people who responded as an academic or faculty member. So we are happy to announce already 2 of the winners, Mohammed Rahal and Stephen Walker. I think you have been contacted. Congratulations on winning this book. And I know the 3rd person has also already been drawn, but is still being contacted. So we will announce the name of the winner as soon as we have been in touch. So I would recommend this book to all of you, but now over to the report again. After this introduction to digital health, we will now move to a bit more introduction to digital health education. And I'm happy to introduce 3 subsequent speakers. Timothy Angst, who will enlighten us on digital health education from the more academic research perspective. Lilian Azopardi from the faculty perspective, and Karima Benara from the students' perspective. And they will also introduce themselves shortly before they move to their slides. So Timothy, I hand over to you.
Greetings, everyone. My name is Timothy Youngs. I'm an associate professor of pharmacy practice in the United States and basically a digital health subject matter expert. So I was tasked with looking over at the current educational status of digital health across all environments, as well as in healthcare and in pharmacy. So let me put this very bluntly. At this current time, there's a large deficit in formal training and education of digital health within all medical programs, including pharmacy. Overall, most of all digital health education is focused on those in business tracks or in certificates, trying to leverage the business aspect of basically building a profit, building a business in digital health, which is unsurprising because we see that globally it is a topic of very high demand. Very many tech companies are trying to get involved with this, and this is where a lot of people are being pushed to go into. So as I mentioned, most of this is actually based around a certificate model whereby people would attend certain classes, do activities, and be awarded completion of a digital health track, for instance. We really don't know what is ultimately the materials or what is the requirements for a lot of this stuff, if they're even following any standards. It seems to be most of the time that they're actually just pulling from internal stakeholders to develop their materials and to deliver that. Next slide, please. So in terms of then looking at this and from a medical side and specifically pharmacy, this is the issues that we currently face. One, there is no lack of standards in education saying what is digital health and how should it be addressed in basically pharmacy education, even in the nation or from worldwide perspective. So what should be taught is still for debate, I would say. And who takes the lead in developing the standards is another issue that has to be established. Next is that we have a lack of brain capital to carry this through at this current time. We have a high amount of interest. Look at all you in this room now listening about digitalization of healthcare and for pharmacy. But the reality is that we also have a lack of enough academics that have background in digital health or any of this technology to carry through and pass on to our students at this current time, it seems to be. So the question then becomes, how do we get our faculty and educators up to speed in order to teach this material? Next is the materials and samples. The other thing that's really unfortunate is that digital health is quite expensive for a lot of things. So if you want to get like digital biomarker supplies, if you want to get digital sensors, if you want to do mock medication adherence, if you want to look into VR technology and things like that, getting this stuff onto a campus is going to basically almost leverage a financial liability at that current time. Also, if you want to keep up on that stuff. And then also having laboratory spaces and such. So next slide, please. So there is a few phases that I would argue that we're currently in. Right now, I would say we're very much an exploratory phase. There are some healthcare programs in pharmacy that are looking at using digital health as an adjunctive or elective track process within their universities or schools, and they do projects, and then they're told that they're like an expert in this at this current time. I would say that what we're trying to get to is an initiation phase where we're trying to basically build digital health or some stuff more formally as elective tracks more broadly across academic spaces or build into the curriculum spread out throughout the material. And then after that would also be a standardization phase where if it's accepted and utilized, then everyone's kept up to date on it as it happens. So this is all this materials in the book chapter. You can go into more detail on it. And I thank you for your time. Please proceed to the next slide.
Thank you, Timothy. And I'm Lilia Nazzapardi. I am a pharmacist and the head of school of the Department of Pharmacy at the University of Malta and a member in the advisory committee of the FIP institutional membership group. It's a pleasure for me to share some perspectives related to the faculty perspective within the context of the developments that are taking place in the digitalized aspect. And a responsibility of the faculty is to reflect on the developments and evolvements that are happening in the healthcare ecosystem, including digitalization. And within this context, the dilemma is how can we incorporate the focus to the new evolvements and at the same time maintain what we are already offering. So the faculty perspective looks towards what facilitates the preparedness of graduates for the digital health revolution, and which are the learning experiences that will support competencies that are necessary for this digital age in healthcare. And finally, also, how can we develop and put forward learning experiences that are going to be effective to reach these learning objectives? Now, how can we answer these questions? There are matrices and frameworks that have helped facilitate the evolvement of the faculty and academic perspective using, for example, the examples that can be drawn from the FIP Nanjing statements, where in the figure on this slide, in the left, we can see on the blue lines, some of the areas that have been highlighted in the FIP Nanjing Pharmacy Education Statements, leading to training and leadership, the professional skills mix, and experiential education. In Europe, the European Association of Faculties of Pharmacy used these Nanjing statements to develop a document representing the 4 pillars of pharmacy education to make relevance to evolvements in pharmacy. And the 4 pillars identified, aligned with the matrix in the Nanjing statements, have been the science-practice balance, the team player effect, redesigning teaching methods, and preparedness for our graduates. And these matrices help faculty to answer the questions, to redesign and revolutionize programs that will ensure preparedness for our graduates. In the next slide, therefore, we can see that from a faculty perspective, the academic group is looking at revolutionizing the teaching programs and building curricula that are needs-based, so that graduates are prepared to meet the existing and emerging requirements as we are seeing in the digitalized healthcare scenario within a context of a collaborative program, and therefore emphasizing the team competencies and sharing these experiences within a broad pharmaceutical setting. I will now pass on to Karima to share the student perspective.
Thank you, Lilian. So, hello everyone, my name is Karima Bernara. I am a 5th-year pharmacy student from Algeria, and it's my pleasure to be speaking from a student perspective. So the rise of digital health technologies and access to outline health information by patients require pharmacy students to be prepared to address future patient needs. And there are many reasons for the integration of digital health in the curricula, as building digital into curriculum would allow learners to have a better grasp of digital health at large and understand the implication of pharmacy practice after graduation, instead just of snapshot approach, which is limited in learning. But what are the tools for the integration of digital health in education, and how digital health should be taught? Digital health components should be included at all levels in formal and informal education and training curricula of all health and allied professionals. For example, we have workshop focused on digital health technologies would be a great way to increase knowledge and experience in an increasingly technology-reliant healthcare space. We have also digital education based on problem solving, learning, and design thinking relates to mini health-focused hackathon. So this hackathon, for example, being implemented by the FIP and the International Pharmaceutical Student Federation, IPSF, to their members and other member organizations. And hackathons are a great way to integrate digital health in education. But one important thing should be focused on when integrating and teaching digital health into education, and that's interprofessional collaboration, because it's a substantial part of the future prof health curricula. Areas such as engineering, computer science, and entrepreneurship have become increasingly important for healthcare graduates, and therefore should be part of the undergraduate healthcare education. Next slide, please. Okay, so what are the expectations toward digital health in pharmaceutical education, and what can students do about digital education? So pharmacy education and effective culture of learning have the potential to drive meaningful digitization of healthcare. Several medical schools are already housing centers for digital health, and when it comes to no surprise that they may seek to expand those formal education to formal education outputs. But how can we as students act toward digital health into education? The IPSF aims to disseminate scientific and professional knowledge, to advocate for the improvement to pharmaceutical education, and to serve as a platform for members to exchange knowledge, experiences, and ideas. So we as students should learn to work together to engage in digital health discussion that aims to tackle public health problems by focusing on technologies solution while bringing multiple perspectives together. Because all what matters is interprofessional collaboration. That's all from me, and thank you. It's back to you, Akshi. Thank you.
Thank you. So now we move to the core of the report, which is the findings from the survey among academics, students, and practitioners. So first of all, I would like to hand over to Shirley, who will introduce the survey and the methodology. And then all of these perspectives will be dealt with by Lillian, Karima, and Whitley in this order. Please, over to you, Shirley.
Thank you very much, Jay. Hi everyone, my name is Shirley Melianti. I'm I'm a pharmacist from Indonesia, and I'm currently doing my PhD in UCL School of Pharmacy, London. So in the next few slides, I will set the scene on why and how we conduct this digital health in pharmacy education survey. So from our previous speakers before, we know that digital health is very evolving area. So to support our workforce with appropriate competencies in utilizing digital health in their practice, it is very important to ensure that the delivery of course in the curriculum and the training is adapted to the current needs. So that is why we basically conducted this survey, because there is not much evidence in the literature about the availability of digital health courses, and also about how the current states of skills and knowledge that pharmacists and pharmaceutical scientists have in digital healthcare. So we have two aims basically that we would like to achieve by conducting this survey. The first one is we would like to investigate and describe the readiness and the responsiveness of education programs to train the current and future pharmaceutical workforce. How we will get this data from? So of course it will be from the academic institutions and also from the faculty members to know about what the educational programs in digital health that they currently offer. That's the first aim from the education side. And another aim that we would like to achieve was to identify knowledge and skill gaps that the pharmaceutical workforce have in digital health. And for this, we survey practicing pharmacists, pharmaceutical scientists, and also pharmacy students to achieve this aim. This slide shows the step that we took till today, our launch. So as I mentioned before, there was limited evidence on previously validated questionnaire on this topic. So we conducted a literature review to identify the survey themes for this topic. Following the iterative process within the core team and extended team, we piloted the questionnaire. We also translated the questionnaire into 8 languages: Arabic, Brazilian, Portuguese, Chinese, English, French, Russian, Spanish, and Turkish. We also developed a glossary that we embed in the survey platform. This survey was distributed from 17 August 2020 to 1st October 2020 through our networks and collaborators. We distributed also through social media and our mailing list. And thank you so much for all of you who helped us completing the survey and also distributing the survey through your networks. So to answer our initial research question, we analyzed the survey based on the category respondents, which are academic perspectives, student perspectives, and also practitioner perspective. And that's how we will gladly share with all of you today. So in total, again, thank you so much for all of your response. In total, we received over 1,000 respondents from 91 countries completed this survey. This table looks a bit busy, but what I would like to highlight here is 3 things. The first one is, as you can see here, we receive respondents across the WHO region. And the second one is at the last row, you can see that we have the majority responses that we got was from practitioners, which is 526 from 70 countries, followed by students from 39 countries, and followed by academics from 60 countries. And last thing that I would like to highlight is we have highest percentage of response rate of all groups from the Europe, and the lowest response that we get is from Eastern Mediterranean. And we will present the results today based on the category of respondents. And I would like to hand over to Lilian now to talk about the result from the academic perspectives. Lilian, the floor is yours.
Thank you, Shirley, and it's a pleasure to give some insight into what were the findings from the academic perspective. The status of what is digital health in pharmacy education today, we can see that around 50% of the respondents replied that they are not offering any insights into digital health. And at the same time, we have around 46% of the respondents who are offering aspects of digital health in the curricula, with the majority being integrated in other existing courses and being part of a mandatory course. So that provides a landscape of the current situation. The encouraging fact that comes out from this report is that the overall perspective of those offering and the ones which are not yet offering any aspects of digital health is that there is a responsiveness to improve in this strategy. A number of challenges have been cited by the people answering the questionnaire, mainly being the dilemma of what to include, how to approach it, and the strategic policy of incorporating digitalization in the curricula. So those were the main challenges featured. And the report that is being presented, particularly this aspect and reflection of the faculty status, is going to serve as a facilitator to kickstart use this responsiveness and this readiness to improve on our digital health in pharmacy education. In the next slide, in the figure, we can see an overview of what is being offered through the blue bars in the graph. And we can see that a number of the participants, the schools which are offering digital health highlight mobile applications, electronic health records, and patient counseling over remote platforms. Those are key priority areas that are offered by over 50% of the schools which are considering already digital health in the curricula. What's interesting in this figure, and why I picked up to focus on this, is that for the schools which are not yet offering any digital health education, when they were asked what they would be considering, it basically reflects in a similar trend, and these are shown in the yellow bars on the figure. It reflects the same trend that we are already seeing in the schools where digital health education has been included. So this gives an identification of the areas that are receiving focus. In general, we can say that the academic group responding in the questionnaire all agreed. So there was no difference whether they were offering already or they are planning to, or still need some facilitators to provide digital health education. All agreed that the focus is going to be that we need to deliver graduates who have a patient-centered digital health provision and knowledge of the digital health tools. And the message is quite clear that we, as academic perspective, it's not only that one is after the digital technology, but we need to embrace the digital aspect within our patient focus in pharmaceutical processes. Thank you. And now I hand on to what the students think, and Karima will be representing that.
Thank you, Lilian. So speaking again from student perspective, starting with the finding a small fraction of surveyed students has received digital health education in their school and or outside their school. And the percentage of students who have taken digital health courses progressively increased, moving from Bachelor of Pharmacy to Doctor of Pharmacy. The second thing is that digital health seemed to play an increasing role during the COVID-19 pandemic, but there might be a misperception among students on the definition of digital health, where they think that digital health is similar to online education. The findings shows that the top digital health tools covered in pharmacy education stated by respondents were online pharmacy, mobile application, and telemedicine. While the top 3 ways used to provide digital health education were e-learning, active learning session, and access to digital health, to digital care clinical platforms. Furthermore, students expect to learn more on artificial intelligence technologies, blockchain technology, as these tools were not covered in their courses. Next slide, please. Okay. So the top 3 skills that students gained throughout the digital health education were interprofessional collaboration, compliance, and knowledge of digital health tools. However, the top digital health skills needs of students were patient-centered digital health knowledge, knowledge in digital health tools, familiarity with the health system, and entrepreneurship. The history of taking courses in digital health might influence students' plans in having a career in digital health, because in general, students who took digital health courses were confident to have a better knowledge than students who did not take digital health courses before. So nearly half of respondents who have taken digital health courses have career plans to focus on digital health after they graduate. So this affected many student choices. The surveyed student highlighted that they need infrastructure such as asset, software, and curriculum, event and activities, and well-trained, especially well-trained and qualified personnel on digital health to support them in getting a better learning experience related to digital health. Among student common themes arose for the support needed from FIP related to education and training, research project, and event. This support also can be done, of course, in collaboration with the International Pharmaceutical Student Federation. That's all from the finding we got from student, and it's back to Whitley. Thank you.
Thank you, Karima. Hi, everyone. Good morning. My name is Whitley Yee. I am a pharmacy specialist in digital health. I work in the healthcare startup space focused on leveraging AI and digital platforms to improve patient engagement and health outcomes. And I'd like now to go over briefly the findings from the practitioners' results of the survey. And so as Shirley mentioned, the main objective of this portion of the survey was to help understand and identify what the knowledge and skill gaps are of the existing pharmaceutical workforce as it relates to digital health. So overall, we had over 500 practitioners respond, and we had a good representation in terms of professional experience, with 15 years being the median years of professional experience. When we look at professional background, over half, community pharmacy was the most representative, with over half of respondents practicing in a community pharmacy setting. We also wanted to look at what the digital health education background was of practitioners. And so we looked at whether practitioners had received digital health education in school or whether they'd received it outside of school as training in their job or continuous education. And so overall, a low percentage of pharmacists had received any form of digital health education, whether in school or as continuous education. However, we did find that for practitioners who had received education in pharmacy school, they were 2.5 times more likely to then receive continuous education later. And so early exposure and education in pharmacy school may be important to increase the desired likelihood of practitioners to then seek additional education later. Next slide, please. Then we also looked at the existing landscape of digital health in practice and how it's being utilized. So overall, there was a high percentage of practitioners who reported utilizing digital health tools daily or weekly. However, when we broke it down and actually looked at the scope of the type of tools that were being used, the majority of practitioners report only using 1 to 3 different tools or technologies at most. So if you look at the graph on the right-hand side, it actually breaks it down by the different tools and what their degree of utilization is. And we have outside, so the top 3 different tools that were used were e-prescribing, mobile applications, and e-dispensing. Outside of these top 3 tools, there was actually very low utilization of different types of emerging technologies, such as artificial intelligence or digital therapeutics. Next slide.
Whitley, can you speak a bit louder?
Oh, yes, thank you. Sorry about that. So another important thing that we looked at were the perceived value and impact of digital health in practice. And so overall, when we asked survey respondents what the top benefit they saw of digital health in practice, the vast majority, over 70%, said that time saving was the top benefit. And then the next benefit seen was improved access and improved health outcomes. However, less than 50% actually indicated that they saw improved outcomes of medicines use as a benefit. And so when we then broke it down to actually look at the different benefits by different technology tools. And so there's a lot of detail in the graph on the right, but what I wanted to focus on was that when you look at the different technologies, there is actually a low number of respondents who see these technologies as able to achieve certain outcomes, such as improved access to care, improved pharmaceutical care. And so there may be a low awareness among practitioners of the purpose or potential that these technologies can achieve. As the primary thing practitioners report was being able to see digital tools as able to save time versus able to actually improve care. Next slide, please. The next slide, please. Thank you. And then we looked lastly at the challenges and the support that practitioners were requesting. And so among the top challenges reported, the main challenges were technical limitations, and then lack of enabling policies, as well as lack of support or cooperation from the health system itself. And then after that, it was lack of familiarity, as well as lack of acceptance at the patient level, which is an important thing in and of itself, is thinking about patient adoption. Overall, respondents indicated that there was a lack of support, a lack of policy or guidance from national or regional associations on how to develop digital health skills, or any guidance in terms of a strategy to increase the scope and quality of digital health in practice. Overall, practitioners expressed that they needed greater support in how to access tools, but most often the type of support that practitioners requested was more examples of how digital health or how digital technologies can actually be applied in practice. And so how do we actually implement and use tools to help make change in providing pharmaceutical care? Thank you. And with that, I'll hand it back over to you, Bokye.
Thank you, Whitley. I must say that I'm extremely proud of the young team that we had that did all the analyses. I would now like to hand over to Bidata, also part of the team, who will enlighten you a bit more on the case studies that we received. Over to you, Bidata. Bidata? Is it just me or?
Bidata, you're on mute.
You're mute, yes.
Could you start from all over?
Okay, sorry, I was speaking on mute. Okay. My name is Bidata Khatri. I'm a pharmacist based in India. So I'm also a part of this digital health and pharmacy education report. And I will be taking you through the different case studies which we collected from different countries. And the main idea of the case studies were to describe good practices on course descriptions, examples of assignments, and learning activities on digital health from pharmacy schools. 13 case studies were included from different pharmacy schools across the globe. Next slide, please. So we received case studies from different countries such as Nigeria, Bolivia, United States, United Arab Emirates, Cyprus, Ireland, Spain, Switzerland, Netherlands, India, Australia, and Malaysia. And in the case study which we received from Nigeria, we found that there was no separate digital health course. However, it was integrated in the existing curriculum in the pharmacy. And also that the student in the university was involved in a special digital health app which focused on the antimicrobial resistance intervention. Similarly, in a case study which we received from United States, the university had developed a framework which was related to the health informatics among the pharmacy students. And the framework was very useful and well received by the students, and it focused on various aspects of the health informatics and also discussed about the different challenges and limitations of the curriculum. And similarly, in another case study which we received from the Netherlands, the students were involved in the development of the digital health as an elective course, and the students were also involved in like development of a individual project where they had to give a digital solution to the existing pharmaceutical care challenge, and this was also very much well received by the students. Next slide, please. In these case studies, we found out that the COVID-19 was a catalyst for digital health in curriculum, and there were different approaches to building health competencies, especially the digital health competencies. And some schools integrated digital health within existing courses, whereas others concentrated it within the specific courses, and the topics covered and learning objectives varied. Some schools took a step back and first upskill their staff and students with digital literacy before moving into digital health courses. Next slide, please. So in conclusion, we found out that students who had a chance to practice digital health had the ability to view and understand career expectations in real life settings, and increase in their ability to take initiatives in digital health. And involving students in the course design was very useful in the development of a digital health course that closely matched their interests and needs. So that's all from my side. Thank you. Over to you, okay.
Yes, thank you, Bidata. So the final chapter of the report that we would like to touch upon briefly, also as a bridge to the panel later on, is the way forward. Next slide, please. So we identified 4 focus areas moving forward that will then be introduced by one person each. So first of all, capitalizing on the benefits of digital health. Then, of course, digital health education and training for the also current pharmaceutical workforce. The impetus for integrating digital health into pharmacy education and practice. And finally, developing the digitally enabled pharmaceutical workforce and FIP global framework for digital health competencies. So the first item, capitalizing, it's over to you again, Bidata.
Thank you, okay. In the past, digital healthcare was an option. It was like an alternative option to the patients, but now because of the COVID-19 pandemic, it has become an essential. Like for every patient, it has become essential, and it is also a very important method of healthcare, which is cost effective and safe as well. So we need to capitalize on the benefits of digital health. If digital health is well understood by pharmaceutical workforce, particularly its higher purpose of providing good health and well-being, pharmacists will benefit from the potentials offered by digital health and become designers of it.
Yeah, so key to the workforce is education. Already mentioned quite a few times by now, I think. It's not only the basic knowledge, also the skills, and also I think that is what has been stressed before by Jacqueline Surug, is also behavior among pharmacists, current and future pharmacists. And we need continuous education, continuous professional development, and also specialization. These all are very critically important. We need to develop educational strategies, and we need to ensure provision of experiential learning, practical elements, because in the end, it is digital health technologies that must enable pharmaceutical care provided by pharmacists as human beings. So it's not either the human being aspects or the technology, it's where they come together. So this is also a critical element. And this report provides an initial evaluation of education and workforce, and provide statements on provide further statements. And I think very important also is that we also embark on future research on digital health education, the outcomes of incorporating more elements of digital health education, maybe also developing indicators, how we can measure whether we are successful. And another part, and it will also definitely come back in the panel discussion, is this is not only about pharmacists, but also about pharmaceutical sciences education. Next slide, please.
Thank you, Oke. You can see actually in this slide, we put an icon of a speaker. So what does this mean actually? So it means that we call all of us to work together on building the momentum for integrating digital health into pharmacy education and practice. So with this report, we would like to call national professional organizations to support pharmaceutical workforce by providing access to digital health tools, investing in digital health education, and developing guidance on how to apply digital health technologies in practice. With an advocacy effort, it will ensure the integration of digital health into pharmacy education and support the inclusion of digital health in educational and accreditation standards. Further research is also needed, an interprofessional collaboration with experts from digital health industry is now needed as well to demonstrate how digital health can be integrated into pharmaceutical practice. So it's very exciting. So I will now hand over to Nilhan for the last way forward from this report.
Thank you, Charlie. So the final way forward area is developing the digitally enabled pharmaceutical workforce and FIP global framework for digital health competencies. So as my colleagues have presented, we listened to the feedback we received from our survey respondents, and one of the needs that we identified from the responses were that there is a need for resources in education and training, and there is a need for a standard framework to support pharmacists to obtain relevant competencies, at least the baseline competencies. So we listened to this feedback, and we will be designing and developing a global framework for digital health competencies to inform development of education and training resources. So this will be one of our priority. We will be working towards this framework, and we will hopefully be launching this as soon as possible. And we aim that this will facilitate the implementation of FIP Development Goal 20 digital health, particularly in the context of developing the digitally enabled pharmaceutical workforce. We hope to receive your feedback on these way forward areas from the chat box, from the Q&A box. And this is leading us to the Q&A part. I'll hand over back to Oke to wrap this up. Thank you very much.
Yeah, thank you, Nilhan. So I think we have now time for some questions and answers. So I'm looking at least virtually to Nilhan to hear what questions we have and to whom they are directed, and maybe Nilhan, questions that are more suitable also for the panel, maybe you can keep them for the Q&A later on. So let's stick with maybe the more technical questions or some other issues that need to be done now.
Okay, we'll do that. So thanks for all the questions coming up. What I've done is I've organized the questions in the context of practice, pharmacy practice, in the context of education, in the context of students, pharmacy students, and some questions around policy as well. Some of the questions are already been answered by our speakers, so you may see the answers there, and some questions will unfortunately be remained unanswered verbally, but our speakers can pick those questions up. The first question was around practice. And this has already been answered, but I thought this would be worthwhile discussing. So when the digital health and e-health is introduced to community and hospital pharmacies, how does it work from the interprofessional perspective to work with the medical communities, with the nursing communities, and all actually the healthcare team? How would that work? I guess this question would go to Jaime and Whitley, as they represented the practice side of things, but I'll hand over to you, Oke, to direct this to the other
yes,
to our
sure.
speakers.
So maybe Jaime first.
Okay. Well, this is a very important and very practical question. Digital health tools are sometimes not easy to develop and implement. It's not only a matter of knowledge, which is a huge gap, but also the resources needed and the connections you need, because most of them relate to other healthcare professionals and especially for the patient. So I would first try to improve my knowledge in digital health skills, which is super important. Not only to know the potential that really can bring to you, as Whitley said in the report we saw, that most of the digital health tools used nowadays are not that transformative of our care provision. They improve, of course, patient safety and workflows and makes it more efficient and convenient, which is a super big driver for digital health implementation. But we are still a bit far apart from beginning to implement the big ones, as Claudia mentioned in her magnificent slides. So I would go first into trying to improve my digital health skills. To summarize, look into regulation. What am I really able to do in my own jurisdiction in terms of my objectives? And I would especially go to my pharmacy association, because they would normally have the right resources to allow me implementing those tools. Also being compliant with regulation, which is not always that easy. That's my answer in a short.
Thank you, Jaime. Any additions from your side, Whitley?
Thank you, Jaime. I think you covered it very well. I was going to just add that we did ask practitioners about what they felt about the ability of digital health to improve collaboration with other practitioners. And so we did have that half respondents felt that it was impactful or very impactful in helping improve collaboration. And just to reiterate what Jaime had talked about, it really does, I think, depend on the individual setting, and it's going to depend on what resources are available locally and what types of technology or infrastructure are available locally. And so it's not necessarily, and implementation is really that's what it really comes down to, is how do you implement it, and how do you get the stakeholders involved to make sure that you have the right things in place to not only have the technical infrastructure, but then also to accommodate with the right type of workflows and buy-in from the other stakeholders involved.
Okay, so implementation is key, I guess. Thank you, Whitley. So Nilan, is there another question that we can take? We have a few minutes.
Yeah, I think some of the questions may go to the panel. So I'll pick the question that come to the academic perspective. So the question was from a remark: the interest is high, but the expertise is low. So the question is around how we can start to try and fill in the skill gaps of the academic teams in terms of teaching digital health.
Okay, thank you. So Lillian, can you maybe pick up on this question?
Yes, sure. First of all, I think the important aspect to consider is that, yes, we have the digital aspect, but we also have the competencies to be able to empower graduates to use that digital aspect in the right way, to avoid risks, to personalize and work with the other team members. So I believe that the skills gap needs to not only focus, we still have a weakness in the digital area, but we have to also look at the course curriculum that encompasses the other competencies that are required to embrace this digital revolution. One other aspect which will improve this weakness is surely by having the academic group, the faculty group, link up with the experiential part and reflecting on the strengths and weaknesses of how digitalization is occurring in the practice setting. So that will have practice support academia and academia support further development of the evolution itself.
Thank you, Lillian. And if I can add from my personal experiences that at least within our school, also people from outside pharmacy, so more the technology developers are very willing and keen on also contributing to the education. So I fully acknowledge that that might differ or between settings, but I think this is at least also something that I have experienced. So maybe one final small question, Nila.
Let's pick one. So this question is about students. So let's cover all the perspectives. This could go to Karima about the students' awareness on or students' digital awareness compared to lecturers. So how the students perceive digital health, how much they know about it. We answered this question a little bit more in our report, of course, but Karima can add a few words onto that.
Yes, please, Karima.
Yes. Okay, thank you, Nilhan. So I would say that it depends, like from country to country, and students from around the world are trying to like develop and increase their knowledge regarding digital health, even if they haven't, like they don't have digital health courses in their curriculum. So they are trying to have online courses. So it depends on the country and it depends on the student capacity and efforts. However, we are trying to balance between the student awareness and the faculties. So we are trying to have a balance between both. Thank you.
Yeah, so thank you, Karima. And my understanding of this question also is, and also again, personal experience, that this is typically also a topic where educators need to be very aware on, let's say, the entry level of students and their needs, because these might be very different from their own expertise, knowledge and needs. So this might also indeed be an area where to some extent students have more knowledge, maybe better skills even as compared to educators. So this is an interesting field from that point of view as well. So I would like to close this first part and shortly hand over to Nilhan for the formal report launch before we go to the internet. So Nilhan.
Next slide, please. So here we are, the most weighted part of, one of the most weighted part of today's session. So we are delighted to virtually launch the FIP Digital Health in Pharmacy Education report. We really hope this report and its findings will inspire pharmacy schools to develop and implement lectures or courses sorry, in their own curriculum, and professional organizations to provide the pharmaceutical workforce with the necessary digital health knowledge and skills. You may scan the QR code that you see on the screen or click on the link that Vidata has just shared from the chat box to download our report. We also invite you to share the report across your network, your organization, your faculty, and please join the conversation on social media by using the hashtags that I'm sharing on the screen now. And please let us know your thoughts on the findings and the way forward areas of the report. We'll be looking after them. We will share the link to this report with you after the meeting via email as well. So please expect an email from FIP. And now we will continue with the digital health simulation experience. Back to our moderator. Over to you, Okia.
Thank you. So it's with great pleasure that I would like to introduce Sarah Ramadan from the UAE, who is the CEO and founder of FarmVGate. I guess I need to pronounce it, but I'll leave that up to Sarah. So briefly over to you, Sarah, for an introduction for this intermezzo and the video.
Sure. Thanks for the introduction. And my name is Sarah Ramadan. I'm a pharmacist from Egypt, and I'm a pharmacy digital technology futurist, we can say. I'm a CEO of PharmaVigate Academy, which is a UAE-based company. We're coming from out of the dynamic, like vibes of Dubai, with a big passion to disrupt how pharmacy learning and development process is doing. So today I will speak about, in a wrap-up nutshell, the importance of engaging pharmacists more and more in digital health. So next slide, please. I guess from all what we got, this backup information we got today and this amazing report, that we can see that digital health is really changing and redesigning how the pharmacy industry will be during the coming years. So the question now, are we ready for this change? Our pharmacists are empowered or just threatened by technology? Next slide, please. I guess we have a big debate about what is digital health and what's online education. Since the COVID came, everything's changed. And most of the pharmacy schools and universities already moved to online learning. But can we have a benefit really from this online education? That's it, or digital health should be on the area? So next slide, please. We need to assure that digital health can be in different formats. All my amazing colleagues, they mentioned how telemedicine, VR for patient education, wearables, robotics and AI, and even the augmented reality can be a way for digital health, the way of the well-being and health production that can be used by technology. This is digital health, but what's online learning and how we messed up with this? So next slide, please. Mostly, online learning will come regarding the virtual sessions. We have the online assessment, digital books, and video learning and learning management system. So this kind of fine line between digital health and online learning is where pharmacists need to be in. But the question now, can we benefit from both? Can we blend both online learning and digital health and make the best use of this? This is our question. So next slide, please. From that, if we blend digital health with augmented learning, we can really have the empowered pharmacy practice that we need. And all the future pharmacists now should be empowered with different tools and different technologies that make their life easier and their job even more efficient. So today I will share with you what we did and how the platform of PharmaVigate is working and how we blended digital health with online learning to make the best benefit of both. So can we move to the video, please, Victor? This is a small video, a descriptive one. From what we got, you can have a small example how it's working, especially in the hospital pharmacy-based settings. The video will show you how you use virtual reality with machine learning to provide a fully interactive and simulative learning experience. This experience is fully personalized. The content will be more matched for what you need, that can build required digital competencies and skills for pharmacists. And also, it will allow fair access for the quality education. And most important, to bridge the gap between the practice, between different content. The platform was owned not to empower only pharmacists and students, but also to empower the educators, where we see base settings and all that will be related to the patient-centric paradigm, we can say. This platform now is very easy for the educator to use, so they can have it as an access for the education, for the assessment, and also for the development or even the grading for the students. As you see, it's very simple, the same like any learning management system, but all the time it will be packed with the simulation and hands-on practices and competencies that we need to empower with our students. Every day we have more about how we can use digital health and how pharmacists should be the one who can develop solutions from digital health. Because now technology either will replace or empower pharmacists. And we're sure that we can support more pharmacy school and educators to blend pharmaceutical sciences with technology. where they can navigate more opportunity in digital health space and develop digital-enabled pharmaceutical workforce, which will really align with what goals we are having or we are aiming in the FIP. This is our digital team, and now the healthcare professionals, especially pharmacists, can work together and learn from each other without any barriers. So Pharma the Gates will be there. I will share with you our link. If you are willing to contribute with any of your contributions, we will be very welcome, and thanks for this.
Thank you for this amazing initiative, Sarah. I think this was your last slide, wasn't it?
Yeah, I'm just finished. All I need from you, either you have questions or inquiries, it will be very nice to be shared with you.
Yeah, so I'm over to Nilhan to hear whether there's any specific questions from Sarah. I noticed there were some requests where to find more information, so maybe you can answer that question yourself in the chat box, Sarah. Any other questions, Nilhan?
No specific questions right now. Some colleagues, as you mentioned, are inquiring some more information, but Sarah, you may respond to that from chat or Q&A box. That's possible.
Yeah,
sure,
so
thank you.
Yeah, so thanks again, Sarah. I think this is the type of examples that we need to share so people have a better understanding of what digital health education could entail. And thanks so much for sharing that. So now we move over then to part 3, which is the panel that we have as a global panel discussion on the report's way forward areas. So it's my pleasure to briefly at least mention who will be on our panel today. So Jacqueline Serup from the FIP Technology Forum and FIP Vice President. We are very happy that both the FIP Professional Secretary as well as the Scientific Secretary, Emma Paulino and Giovanni Poletti, are with us. From FIP Ed, we have the FIP Ed Chair, Ralph Athier, and of course, our CEO, Catherine Duggan. So welcome to all of you. And as a starter of this roundtable panel, I would like to ask each of you, what was the most remarkable finding from the survey or from the presentations today that you thought was interesting and that we should take on for the future? So maybe can I start with you, Jacqueline?
Yes, thank you very much, Oke. One of the striking things for me from this report is, from one side, the perceived value of the need of digital health education from practitioners, from students, all those who practice, and from students on one part, and on the other part, the deficit of digital education in faculties of pharmacy, especially the statistics that were presented that more than 50% of the faculties of pharmacy don't have any digital health education. And this is despite the perceived value of digital health technicity in practice. So I was thinking, maybe, of course, the first thing is to raise awareness among the faculties, but I think the awareness is there. Now I am thinking that maybe there must be some completely different approach. Of course, having trainees which are competent in health, but also in the way of, how can I say, education should be done for this topic, because the step is high. It's really a challenge to implement this in the faculties of pharmacy. There is something we do in hospital, and this is also an approach which is used in community pharmacies. We are talking about a patient-centered approach. And I was thinking maybe it's time to think about a student-centered approach in the faculties of pharmacy, where students could be, let us say, feel more confident, more valued, more with a special approach in this topic, which is a very difficult topic. what is important to me, to my eyes also, is the inter-collaborative approach, because all what we feel from the pharmacy side, other healthcare professionals are feeling it also, from nurses, from medical doctors' side. And I think all this could be combined in an inter-collaborative approach. So just now, this is my first feedback. Thank you, Aukje. Back to you.
Yeah, so thank you very much. And I think this is something that we can come back to a bit later in this panel, indeed, like what could this alternative or completely different approach be? What could be the role, maybe also of FIP Ed, of the or maybe also of the professionals? And I would also like to invite the audience to maybe put suggestions for such an approach in the chat, so we can maybe also build on that. So over to you, Emma. So what did you find most striking in the results, and what do you see also as the role of the healthcare professionals, so the pharmacists, maybe in this completely different approach that Jacqueline already proposed?
Yes, so thank you very much for the opportunity, and congratulations to all those involved. It's very impressive. And first and foremost, even what impressed me the most, I think, is the number of people that actually participated in the report, not only directly as authors, but those who responded to the survey, and the fact that so many people from so many different countries participated. So that was one of the most interesting things, I think, aspects, is to see that there is really an interest in understanding how digital can, on one hand, assist in terms of the education of the pharmacists and pharmaceutical scientists themselves, but at the same time, how can digital also help us as professionals in our day-to-day activities to increase proximity with the population. And I think that what is also very interesting to see in the report is that this report just highlights what we have already been in a way discussing in the past couple of years, which is that a change of narrative from digital and automation is going to replace us as professionals and as people, and it really is a barrier to human interaction, to a completely different narrative, which is how can we use digital to increase that human connection, to enhance what we can do for the patients, to accelerate our health solutions, to increase proximity amongst the different healthcare professionals. So I think that this narrative is much more optimistic, is much more looking towards what we can use in terms of technology as a tool to really enhance the scope of practice which we have in the different practice areas of pharmacy. And I think that this report really highlights that optimistic and constructive narrative around what digital can do for us as healthcare professionals, but especially the potential that it has to enhance the care that is provided to the people. So that I think that's the most important aspect of the report, is really that optimistic narrative.
Yeah, thank you, Emma. And I fully agree that we should embrace these digital and technologies as an opportunity that will strengthen, I would say, the role of the pharmacist, indeed, instead of maybe something that is might be jeopardizing our role instead. So I'm very happy to hear that message came quite well across. So now moving to Giovanni, and maybe from your point of view, I fully acknowledge that the report was maybe mainly done within pharmacy schools and not yet within the pharmacy science education in a more broader term. So what is your most striking message that you found in this report and that you would like to build upon?
Thanks, Aukje. I think the key message for me is it is the beginning of a larger journey. And as Jacqueline mentioned, it is a compilation at the global scale of what we need to do in order to be prepared for the future. And that involves sciences as well. And I believe the scientific education of a pharmacist in order to deal with the information that is provided by these digital tools will become even more important in the future. My field of expertise is biopharmaceutics and pharmacokinetics. So there are a lot of modeling approaches that we can bring now to the bedside in order to explore different therapeutic options for a patient. But somebody with scientific skills need to be able to assess what is the best approach for the patient. The tools give us the options that are available. And so I think as compared to all the other healthcare professions, I think the pharmacist with a solid scientific education has the experience and the knowledge to make informed decisions after consulting with these outcomes from the digital tools. And certainly moving into the scientific area, there are a lot of things that we have to catch up in terms of understanding what the needs are for pharmaceutical sciences as relevant to the drug development and distribution side.
Yeah, thank you very much. So I think also being involved in this report showed again that it's much more than just wearables and apps. It's also 3D printing, for example, and stuff like that. So definitely strong sciences are also needed for further development, I guess, of those technologies. So I would like to move to our fourth panelist, Ralph Altier, the FIP Education Chair. I assume, Ralph, that this report and also the recommendations must be close to your heart as well.
Well, thank you, Akia. I just want to express my thanks to yourself and to Nilhan and all the other organizers of this report because it really, let me just start my video. I just got a notice saying I should turn my video on.
Yes, thank you.
It really is the foundation that we need for moving education and digital health forward for pharmacy. I think the good news is we're not far behind anybody else when it comes to education in digital health in any of the health professions. The opportunity, I will use that term instead of the bad news, which is we have a lot of work to do. Probably what is, I would say a clear message here is if we try to do it on our own, we probably won't succeed as fast as we want to. We need to collaborate. And you mentioned this yourself. We need to collaborate with people outside of the health professions, outside of pharmacy. You know, the technology companies are the ones who are driving all of this. It's not the health professions that are driving it. The health professions are trying to keep up with what the technology companies are doing. They got into digital health in a big way. And they charge ahead. You know, they have all the money, they have all the expertise, and now we have to learn from them. We have to work with them, and we have to work with those in our universities who have expertise in these areas that could help us upskill our own faculty so that we can provide the education that is needed for our students. Not just obviously for the technologies that we have today, but those things that are coming in the future. We didn't spend a lot of time talking about machine learning and artificial intelligence, but they are getting bigger and bigger every single day. And we need to have a focus on those. I think all the ones that were talked about are all necessary and they all need to be done, but not sufficient. So we're gonna have to spend, I think, a bit more time on the machine learning and AI aspects of this. And again, how they can augment the care that's given by pharmacists in the patient care model. So the one other thing I think I would add to this, because I think it came out in the report and in some of the discussions today is, when I look at it in terms of education, there are sort of like three domains. One is the education that has to go across every single student and all of our practitioners. And those are, how do you use these technologies? How do you implement them? How do you use them to improve patient care? Obviously, that's a big ticket item, and there's a lot involved there. But the second one is, and this was mentioned a little bit here and there, is how do we educate our students and our pharmacists to be the designers and the developers, not just the users? Now, that's a smaller subset of people, but I think it's very important for pharmacy to be in there in that development phase as well, to optimize it for the practice of pharmacy. And the third one is, and we saw that with the last video, is blending our remote or online education and the tools that the digital tools that we can use to enhance the learning process among our students and for our practitioners, and then blending that with digital health. I think this is another area that's really key for us to be thinking about. So lots to do, but you know, this has opportunity spelled all over it, and we should take advantage of it. There is one other aspect, if you don't mind me just throwing one more out. It's more than one key message here, and I know we're going to be talking about this, but you know, COVID-19 not only accelerated all of this, but it made more pronounced the inequities that exist in our health systems within each country and across the world. We're going to see the same thing when it comes to digital health education. And we need to be able to address that. And again, I think collaboration amongst high and low and middle income countries, collaboration within the FIP sphere as FIP education sphere is going to be really important for helping to address those inequities. So I just want to keep that in mind.
Okay,
thanks,
thanks Ralph. You mentioned a number of items that I hope we can come back to during this panel discussion. But before that, I would like to give the floor to Catherine, also to give a first reflection on the report and the webinar today.
Thank you so much, Oke. Thank you so much to everyone who's on the panel and in attendance today. It's super exciting to always be at such a launch, and I'm extremely proud to start the year off with the launch of something that's so important. I have four key reflections, really. The first is that we've been talking about acting like one FIP and working across all our agencies and all of our constituencies, and I think this is a real area where everybody in FIP is needed. And you see we have the Technology Forum front and centre in this work. But not only that, we need to now focus on science and technology and supporting our scientists with this. We need to focus on the practitioners. And actually, the take-home message would be that the priority focus would be on education and faculty support. Ralph mentions a really good point there about what can we do to enable that. I thought it might be useful as well to not just think about what we need to do, but what we have already, because sometimes you can look at recommendations from report and get a little bit overwhelmed with the jobs in front of us. And Lillian mentioned in her presentation the fact that we have so many statements that were launched more than 4 years ago in Nanjing around education, which kind of formed the standards of education that we need to think about across all of our countries. And this is a really good opportunity for us to map the needs of our digital health requirements against those statements and make sure that that really supports everybody in reaching their goals. I also wanted to make the point that the vision of FIP is a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies, as well as from pharmaceutical care services provided by pharmacists in collaboration. Well, we can adapt that vision to digital health. And whilst our students and our practitioners and our educators and our scientists are super important in all of this, the whole reason why we do the jobs we do is for the patients and the public that we serve. So Ralph's quite right. We make a mention of the fact that we must not allow digital education to become inequitable, but we also need to support all of our patients with digital health in the future as well. Could I mention then that the recent update to the global competency framework that we have at FIP includes digital health competencies. So we're way ahead of the game in that regard. In addition, we can look to see what competencies our faculty need and our students need. So I just wanted to make that delineation so that we really focus on the initial education and then the workforce out there with what they need as well. My final point, Oka, is that when we did our transforming vaccination program, one of the ways that we could see how vaccination was really a vehicle for us to deliver many of our goals, we can also consider that with digital health. We have digital health as goal number 20, but we also have goals in our portfolio around equity and equality, and that includes patients and the public, sustainability, and that includes patients and the public, and we also have leadership, and that includes all of us in the profession. So I see a real opportunity for this work to map against lots of other goals that we have, as well as delivering the digital health goal. And I see we can use the competency frameworks we already have to best effect, and we can embed the statements we have in the investment we need to make in education for our faculty, for our scientists, for our professionals, and for our students. Thank you so much.
Thank you. So I would like to pick up on the point of equity, because what I noted from the chat box, for example, is that people mentioned that digital health technologies could be a powerful tool also in low and middle income countries, because you may reach patients in rural areas, for example. We also see that when we look at the countries that people originate from that are currently following this webinar, it's really from across the world. So it spans all income levels, I would say. At the same time, I think it was Timothy who also kind of reminded us that digital health is not very cheap. The technologies might not be cheap. It might require additional work from the pharmacy. So the question is whether people have time to do and use the technologies. So how do we find the right balance, ensuring that there's real equity, that nobody is left behind? So I would like to hear a few of your voices. So maybe can I start with you, Emma, from the perspective of, let's say, the practitioners. So what can we do? What should we do? How do we ensure that we have the most benefits from these technologies across the world?
Well, I'm very glad that the International Pharmaceutical Federation has actually set as a goal to discuss these equity issues, because we are seeing within this COVID-19 context how it is actually increasing the gaps between those that are fortunate enough to have access to information, resources, medicines, healthcare in general, and those who have not. And I think that we are, unfortunately, in health, we haven't been able to be very democratic in the way that we have made available the resources that we do have. But I firmly believe that digital can actually help us in addressing those gaps and decreasing those gaps, and by making available those resources and basically establishing through projects like for instance, Unitwin, in which we have been involved, establishing relationships between different institutions and individuals who want to address the same issues, and by promoting mentoring activities in which digital can also be a facilitator. So I think that we have to address it from the context perspective and from the infrastructure perspective, and then in our daily practice, and speaking from the perspective of the practitioners, I believe that pharmacists, because we are so well embedded in the communities, have an individual responsibility to address these inequalities and ensure that we deliver our services in by promoting equity in terms of the access to those services. In FIP, we already have a report about women and responsible use of medicines, where we looked at how through community pharmacies, for instance, we are able to address the issues about raising and empowering women in terms of their responsibilities within the household when dealing with medication. So I think that we are in a good position also as practitioners, because we are so close to the community and our resources are available to that community to provide enhanced access to the information and the resources. And we've seen some examples of that, where, for instance, community pharmacies have made available their computers for patients to have online consultations with their doctors. We've seen pharmacies contributing to patients signing up on electronic health records, also using technology to interact with physicians. So I think that we have a higher responsibility here due to the fact that we are in the community and we are able to a lot of the times see people who for themselves don't have access to these resources. So definitely there is a lot of responsibility here in addressing these gaps.
Okay, thank you, Emma. You already mentioned the UniTwin program, so maybe over to you, Ralph. Any additional thoughts on how to deal with this equity issue in education?
Yes, well, I thank you, Emma, for pointing that out. And so let me just separate the two, kind of the issue, some of the issues Emma was talking about in terms of the access to medicines and empowerment of women to take control of medication use within their family units and things of that sort. And I'm going to focus on the inequities on the education side and the resources that are needed there. So, and I will have to say this, it's true for digital health, and it's true for the digital education, is that you have the difference between high and low and middle income countries for sure. But even within high income countries, and I can say it in my own arena, is not everybody has high-speed internet access in rural areas, even in the United States. And so there's inequities there just in access to the basic infrastructure that you need to get the job done. So that's something that's, we can advocate for that within FIP, but there's not much we can do to control it, and we have to be able to deal with it. Certainly one of the things I think pointed out in this report is the extremely widespread use of mobile apps and the availability of phones to in many areas around the world to be able to connect with people. And I think that's something we have to take more advantage of. But the other thing, the UniTwin program, UniTwin stands for University Twinning, and here is where we have collaboration and partnerships between universities. And Catherine could talk more about this, but there's the beginning phase of partnership models within FIP. And I think that's going to be, or can be, a big driver for addressing some of these inequities of partnering universities and faculties of pharmacy with each other, those who have expertise in areas, those who desire the expertise in those areas, and how we might be able to work together to offer the kinds of educational programs that we need to do. So that, I think, is just one way that has a lot of potential for that. There are other systems within FIP for doing these connections and these networks, certainly the academic section, the academic institutional membership group and stuff. But the boots on the ground are faculty to faculty, right? We know that. We've got to get them connected And I think that's how we can address some of these inequities right there.
I think very important indeed. Thank you. So I'm quite well aware of the time. So I think we should go over to Nilhan and take out some questions from the audience. So Nilhan, can you pick out a question that you think is interesting, and then also maybe indicate whom to address this question to?
Thank you. Okay. Thank you to our panelists. There was a question that came before, so I would like to start with that. It's about policy. The question was about how can we help members and leaders of our profession, as well as policymakers, to view digital health and technological transformation, not as a tool to help us do our job better. I'll rephrase the question again. So the policymakers should see the digital health as a tool to make our current jobs better, versus technology is going to take over us and we are going to be obsolete. So how can we implement that mindset to our policymakers? I think the question would be general.
Yes, but maybe I can invite Jacqueline to first give her a thought on that, and then maybe over to Catherine thereafter.
Well, thank you, Auke, and thank you, Nilan, for the question. The technology is a tool. We must never remember that. At least if we don't want the tool, you just unplug it. Yeah, you must be aware of that, because often people think, well, this tool will take my work. It is not true. The tool is here to help you in your daily practice, to go quicker, maybe safer, because the tool doesn't make normally errors, and finally do it in a safer way. So do the process in a safer way. This is what the tool is. And while I am I have the mic, may I make a remark? Always remember and never forget that the tool can fail. And if there is no tool, you will have to do it in a traditional way, the process. And this is very, very important to never forget. I see in my country, in France, we recently, and there are several examples like that, we recently had an hospital where that was hacked by hackers on the data. All was suppressed. And then everybody was lost because nobody knew where to find the data in the traditional way, no paper anymore. So all this was lost. And the result of it was that you have to transfer all the patients in the next hospital. So we should always be conscious of that. Okay, I hand it back to you, Auke.
Yeah, and I would like to invite Catherine then to also give her perspective on this question.
So I just build really on what Jacqueline has said. We are very, very right to acknowledge the risks. We have to acknowledge risks of everything. And then to manage that and mitigate the risks. So one thing that we can say about the dreadful times we're in at the moment with this global pandemic is that patients and the public, like never before, have needed to access community pharmacists and community pharmacies in their communities. So online is very convenient, but they needed that conversation, they needed that advice, they needed that trusted healthcare professional on their doorstep. They also need accessible medicines that are handy and able to be delivered in easier ways. So I would argue that we need to find a place where we can balance technology, digital, alongside the person and the interface between two individuals or more. You know, the personal touch can never be got rid of. And I agree with Jacqueline completely. If you go one way or the other way, you maximize the risks rather than minimizing the risks. There's one other point I wanted to mention, and I think we at FIP need to look across other areas in our societies at the moment. When we see students having to, or pupils having to study at home at the moment because schools are shut, there are lots of innovations that will come from this that will help us with how we can increase digital access in the coming weeks and months. And I wanted to just add to Ralph's point earlier on that we need regional roadmaps and we need action plans that are based on the needs of the regions and the countries within them. And the sharing and the supporting and the partnerships and the provision that one university or one part of our practice can give another will be a model that will be so helpful for the future. Finally, the point that, well, one of the things that we've learned in FIP is that FIP is an umbrella organisation that makes and forges friendships and collaborations through networks. That is done very well face-to-face. But may I just say that you can have an increased reach and an increased accessibility through the digital arena if it's used appropriately. And we have seen that. Many of our colleagues who would not be able to come to events have been able to access things through FIP. So my answer, in short, is we need both. We need the face-to-face and we need the people, but we also need digital and virtual access to support us as well.
Yes, thank you very much, Catherine. And I think one of the things that was mentioned earlier as well is that digital health education is not the same as online, but they also come very much together because online education, online networks, as you mentioned, can help us to advance also in digital health education, digital health, pharmaceutical care. So I definitely agree with you there. I am conscious of time. I know that some people needed to close at least not too long after 5 o'clock. So Nilhan, is there one kind of remaining question that we can deal with as the final question for the panel?
Yes, I will. I'm summarizing maybe 10 questions into one, just to make it effective. So we've discussed the issues around low resource setting countries, developing countries, the issues around equity. And some of the questions we received around that they don't have the sufficient infrastructure or the policy interest from the policymakers. So perhaps the question would be around how we can make sure digital health in pharmacy education or in pharmacy practice, wherever it should start, can be taken as an imperative as policymakers, professional organizations. So perhaps we could receive some advice from our panelists, particularly in the context of countries where they don't have necessary infrastructure or investments.
Thank you, Nilhan. I hope so. I will ask the panel. So is there a panel member that would like to respond to this specific question? Well, it might not be specific. It's actually quite a large and broad question, but to this question.
Well, I can try to at least say something about this. I think that we have to present, like in everything, we have to present this as an investment that will have a good return on investment, particularly in terms not only of enhancing care, but also increasing efficiency. So a lot of the times I've seen terminologies like avoidance of duplication or decreasing the gaps, etc., being used as something that as a positive in terms of investing in technology in order to enhance the efficiency of the system. And I think that if we have a good case for that return on investment, then it is easier to catch the attention of the policymakers. At least that's what I've seen in different countries. And I would say that the role of FIP in terms of collecting the evidence from the different countries in terms of what each country has done that has shown a return on investment. So for instance, we have countries where we have electronic prescribing or where we have pharmacists accessing electronic health records or universities investing in digital learning opportunities for students. If we can get information about the return on investment that we get once we invest in these kind of processes, I think that that is most useful from an advocacy perspective. So I would say that collecting this evidence and then reporting back and presenting it to the governments as such is more effective. And I think that Catherine would like to add on this.
If I may.
Final word to you, Catherine.
Thank you so much. Well, I think some of the things that we've seen that have worked in recent years, perhaps taking the example of vaccination and pharmacists involved in that, is creating an advocacy toolkit. And this does exactly what Emma says. It's about where you take case studies from different places around the world where the investment has shown a return, and also how they've lobbied and how they've advocated for this change, and perhaps some of the things that have gone really well, and as helpfully, some of the things that have gone less well. And these case studies can be pulled together into a toolkit. And I think having a digital health toolkit would be where we think about faculties and students, but we also think about early careers and thinking about all the resources that we have, as I mentioned, you know, with our competency frameworks that exist, and then also thinking about people advancing in their careers. We could do this as one of the initiatives, starting the case studies over the next year or so as people share them with us. And I think that's a super idea, Emma. In this way as well, may I say, we're not just including the education and the practice, but we could look at the innovations in science that technology is enabling and supporting as well. So it could be a one FIP digital health advocacy toolkit, and I'm sure Jacqueline would support that with the technology forum as well, because this is exactly what would be a practical output. I'm getting excited, okay, and we can, you know, put that into the 2021 business plan, but I think that sounds amazing. And having some digital events around each of the case studies would just seem to help those who are on the ground. Lovely.
Thank you very much, Catherine. I think it's time for a small wrap up from my side on this very exciting webinar. And I think the enthusiasm that Catherine was just displaying is at least with many of us and also for the future. So what started as a very a small project has become a large report. And I think this webinar also showed there's so many angles, so many aspects that we would like to build upon, that we can do, where we see opportunities to showcase what is already done. I definitely think that this is a topic, and I would like to confirm or to mention again, to emphasize what Catherine said. This is really a one FIP topic, and I think we have within FIP structures in place that can help us to really take this to the next level. So I'm really looking forward to the FIP Technology Forum work, maybe the development of this advocacy toolkit, but I know there's also other events and things in the pipeline, Jacqueline, so we will definitely see more from the Technology Forum. I also think about the academic pharmacy section, also some ideas on how to train the trainers, for example, because a lack of expertise and thorough understanding of digital health education among faculty members is also a very important issue. So I hope that the optimism that Emma found in this report will stay with us and will also something that we take along the road that we have ahead of us. I think it's an interesting road. These are sometimes difficult times also because of COVID, but we've also seen the many interesting initiatives that such a disruption has given, and I think I hope at least that people will see and seize and embrace the opportunities that the current times have. And I also fully agree that the science is basically the backbone, I think, of all of this, because without the science underlying these technologies, we would probably be nowhere. And so it is the developments in the technologies that are probably ahead of us, and we need to keep up with these technologies and see how we incorporate this in our daily lives, being a scientist, being an academic, being a healthcare professional belonging to the pharmaceutical workforce. So with this, I would like to thank all of the people who contributed today to this webinar. Of course, not only the speakers, the panelists, but also the very active Q&A. I'm really sorry we couldn't address all of your questions today, but I hope many of them have been answered by the colleagues in the chat. I think it's over to you, Nilhan, to do the final remarks.
Thank you. Okay. With your powerful messages, we are wrapping up today's event. Also, we are thrilled with your engagement through the chat box, from the Q&A box. Thank you for your support and insights. As I also wrote in the chat box, now we have more than 4 way forward areas to tackle. We have a big to-do list, but we are enthusiastic with your support to tackle them one by one. I would like to sincerely thank to our moderator for excellent moderation, to our speakers, panelists, co-facilitators for their insights, for their great support. It was an excellent session. And of course, to you, our participants, for joining us from all over the world today. It's great to have you with us until the very end of this session. I invite you to download the report. Once again, join the discussion on report findings and support our actions for way forward areas. You may scan the QR code and use the link to download that. If you have any questions and comments, please contact us at education@fip.org. And thank you for your support to global pharmacy education in shaping the digital health transformation. Have a nice day, have a nice afternoon or evening. Thank you very much.